Thank you, Vanessa. Thank you, DSI. This is a great opportunity, and I appreciate what the speakers have said so far. I'm Dr. Andy Goldsmith. I'm the creator of rapport-based selling. I'm going to start off with a story about the bridge that almost wasn't. Dr. Bob was a very talented dentist, meticulous with his preps, and respected by his peers. A new patient came in one day. He was missing a lower molar, and Dr. Bob came in, did his exam, got up, and he said, "You need a bridge to replace that missing molar. I'll have my team put together an estimate," and that was it. Diagnosis, treatment, and cost. Patient nodded. He said he would think about it, and he left the office. Patient never came back. Months later, patient went to another dentist. This dentist did something different. This dentist started with a question. "Tell me how your teeth have been affecting your life lately." Patient opened up. Patient talked about how he was embarrassed to smile in front of his grandkids, how he started eating different kinds of foods, and how he had started to wear down teeth on the other side of his mouth. The dentist asked more questions, respected this patient, and communicated with him in a way that was respectful to the patient scheduled that same day. You see, rapport isn't just fluff. Rapport is the foundation of trust, and trust is what drives treatment acceptance. In fact, studies show that patients who trust healthcare providers are 2.5 times more likely to follow through with treatment recommendations. So what is rapport? Rapport is kind of like Wi-Fi for humans. Strong signal, smooth connection. Weak signal, awkward buffering. Rapport is defined by a close, harmonious relationship between people that understand each other's feelings or emotions and communicate well. Isn't that what we want in dentistry? Isn't that what we need? So rapport is also not just a buzzword. Rapport is also an acronym that stands for a system of questions that could be explored further with additional time. R, relational questions. "Hi, Mr. Jones. How are you? How's the family? How are the dogs? How are your kids? How's college going? What brings you in today?" Relational questions. A, assessment questions. "Oh my gosh, how did you break this tooth? How did that happen?" Polite questions. "Ooh, does it bug you when food like chicken and pork gets stuck in that tooth?" Because we know that they do. Prognosis questions. These are the questions that dentists are afraid to ask. "What do you think will happen if we leave it like this?" "John, what do you think will happen if you don't stop chewing tobacco?" We don't ask those questions because we're afraid to offend people. Observation questions. Now, this is where we turn our attention onto the patient and we go, are you looking jittery? Are you looking upset? Are you looking for the exit? And then request more information. "John, you look a little uneasy. Tell me what you're thinking right now." And treatment questions. Treatment questions are the questions that bring it all back together. "John, how would it feel for you to know that we could fix this tooth without it breaking again?" This system allows patients to make informed, confident treatment decisions. So going hand in hand with rapport is what I call the value equation. You must first prove value before you present cost. Dr. Bob, in our scenario, didn't prove value. He only presented cost. So let's break that down tangibly. Patient comes into your office. They think their teeth are fine. They're there for a checkup, right? This happens every single day. You go in and you tell the patient, "You need 5 crowns and an implant for $7,000. The patient's perception is, "You're freaking crazy. That's a ridiculous amount of money because my teeth are fine." So what we do is we shift the conversation to the seriousness of the problem so that the seriousness of the problem outweighs the cost of the solution. And by doing that, treatment plan acceptance skyrockets. I had a patient walk into my office, this is actually maybe a month ago. Golf ball size swelling on the side of her mouth. Floor of the mouth was swollen. Medically urgent, right? I asked this patient, going through my sequence of questions, what's most important to you? She said, looks. Looks? Looks are most important to you? Well, hey, listen, that answer changed everything, because what I did was I framed my conversation around her appearance. I framed the conversation around the fact that the treatment would improve her appearance. And when I did that, she connected with everything that I was saying. Because patients don't buy on what's most important to us. They buy on what's most important to them. So let's walk through this. A patient comes in with this tooth. And remember, rapport isn't just a fancy acronym. It's your GPS for asking a series of questions so that the patient thinks you're brilliant and, they make informed consent decisions. Hey, John, what brings you in today? Oh my gosh, how'd you break that tooth? Now we're going to plate questions or assessment questions. Does it bother you when food like chicken gets stuck in there? Plate question. Prognosis question. What do you think will happen if we leave this tooth like this? Okay. Now I turn my attention back to him. John, you're looking a little uneasy. Tell me what you're thinking. Next, we go to treatment questions. The value of the solution is what creates importance, and we do that through treatment questions. The treatment question is, how would it make you feel knowing that this tooth could be fixed so that it wouldn't break again? These questions allow people to emotionally engage with what you're saying. And when they do that, that's where decisions are made. So why would you want to offer this program? Well, besides the fact that rapport-based selling is a copyrighted technique that has proven results, how would it make you feel knowing that your attendees walked away with a skill that they could use in their offices tomorrow? Not after a weekend seminar, not a year from now, but tomorrow. This program teaches dental professionals how to communicate effectively with patients, build trust faster than the golden retriever, and bonus, it also increases treatment plan acceptance. I'm Andy Goldsmith. I teach rapport-based selling. It's based on magic. No, it's based on science. But the magic is what you get. Trust. Trust that drives patients to make the right decisions. Dentists sleep better at night, and treatment plans stop collecting dust. Thank you.